thank you, everyone. And I appreciate everyone coming. Thank you for being here, especially on one of the nicest days we've had this spring yet. So that takes a lot of dedication. We're here today to talk about functional and regenerative medicine. It's kind of what we call a newer trend. We in medicine had been focused, I believe, a lot on treating a disease process and waiting till everyone got sick or developed something and then decided to give them a pill or a treatment or something at that point. But right now, the way things are going, we really want to make sure we prevent problems before they happen. And we do know that we can do a lot of that so that we can improve or decrease a lot of the disability and dysfunction. It's my goal to actually try and decrease the dysfunction and disability in Franklin County by 50%. These are people who are maybe at home in a wheelchair or who are bedridden, who need 24/7 care. A lot of things that they have that's creating that issue can be prevented or are treated more appropriately with regenerative medicine so that they don't get really severe symptoms later in life. We want everyone to be as vibrant as possible for as long as they're here. So we want everyone to enjoy their life, not just endure it. Just a little bit about myself. I've been in Franklin County for 17 years or so. Family medicine board certified, and throughout my practice, I've had a lot of people come in over the years and say, you know, I have all these symptoms and I've been to 7 doctors and nobody can fix me. And, you know, they say all the lab work is normal, nothing's wrong. So they just tell me, you know, to, you know, eat healthy and exercise. Or a big one I hear is just, they told me to just deal with it. I'm getting older, or I have 5 kids. What do you expect? You're going to be tired. You're going to have a mental fog and things like that. One of the other things is like a lot of joint pain. I've always said when people come in, they have, you know, a lot of arthritis pain and things like that. The only thing we really have for joint pain that's common is like taking an NSAID, and we know that that just tries to decrease the inflammation and it doesn't fix anything. And it's been that way since I've been practicing, which I'm not happy about, because you think we could have done something about that to prevent a lot of the disability and a lot of the surgeries. Everyone right now, a lot of the theory is, I hear people saying, you know, whether they have a lot of knee pain or hip pain and they get arthritis that's severe, the surgeon tells them, well, you know, just wait till you can't stand the pain and then we'll do a surgery. That's something we want to avoid. So I'm just trying to give you some practical tips or some basic guidelines on how we can try to prevent things that we can so that everybody enjoys the rest of the time we have here. So one of the things that we label it now functional medicine. That's something that means that what we're doing is we're taking a patient's symptoms and we are actually looking at all of your biomarkers. Now, before we just used to do like a complete blood count, CBC, and a TSH, and your cholesterol. But if all that was normal, we would say, well, you know, there's nothing we can do, you know, just, you know, try and deal with whatever symptoms you have, take some Tylenol, ibuprofen, or, you know, if you're not feeling well, you have anxiety and some mental instability type things, we would just say, well, here, take an SSRI, and that doesn't necessarily fix anything either. So what we'd like to do is to treat those things actually. So there's a lot of tests that we do in addition to the sugar, the liver, the kidneys. We check the blood counts. Now the blood counts can tell us whether you're anemic, if you have allergies, if you have signs of infections or things like that. It can also determine what types of anemia you might have, whether it's a vitamin deficiency or you're having blood loss. So we do all of those routine tests, but then we also do things like hormone levels. We do estradiol, and because that can provide a lot of benefit, we do testosterone testing. We do thyroid testing, but we don't just do a TSH, we do a full panel because we want to check. There's a couple different thyroid hormones, but only one of them is actually active and working in your cells. So we'd like to make sure we get an eye on that and see if it's actually present, or is there a problem with the mechanism to create the T3, which is the active one. your thyroid only produces something called T4, which is only a storage hormone. So your body has to actually change it and make it T3, and then that's the one that actually does all the work. So some people have a deficiency in that enzyme that cleaves that, so we'd like to address that. Even though people can have a normal TSH and a normal T4, they may still have thyroid symptoms because the T3 isn't high enough. So we do a lot of different tests. The cholesterol, and now we have newer cholesterol tests, the ApoE, the ApoA1. I wrote a list of all these too on your handout, just to show, these are things that can be ordered to evaluate what needs to be done.
So page 4 of the handout.
Yeah, so those different types of cholesterol panels can tell us what, and we always knew that HDL is the good kind. It actually is used to produce things like hormones and in cell membranes and things like that. Then we had the bad kind, which we didn't want too much of, which was the LDL. So we could measure that, but we have newer ones called ApoE, which is part of the good kind, and then ApoA1, ApoB, and APO. So we're checking those two because they would indicate the ApoB and the A1, I'm sorry, the APO, the little APO would indicate higher risk for cardiovascular disease, whereas the ApoE helps the cholesterol, so we want a lot of that. But in any case, those are, and there's other inflammatory markers. Homocysteine and high sensitivity CRP are the ones we use the most. High sensitivity CRP is not very specific, meaning you could have cold and it's elevated, or you could have pneumonia and it's elevated, or you could have joint pain and it's elevated. The other one is homocysteine, which is more particular for things like cardiovascular disease and things like that. So we do check different panels of things to see where we need to pinpoint what we should be addressing with each individual patient. And that they're calling that the patient-centered approach, although I always thought, we were doing a patient-centered approach. We need to ask the patient what's going on. We need to really take a look at what's going on. But they've kind of returned to functional medicine, the patient-centered approach, because we're looking at all the little biomarkers and addressing anything that isn't optimal. Anything that's at the low end, we think, and you're having symptoms related to, we think that could improve. So we do try to do that too. Also, when we have symptoms of different things like osteoarthritis or osteoporosis, you can see that on the DEXA scan, there are things that we can do to regenerate new tissue. So that has come out in the past, more so in the past, 1 or 2 decades. So not that we have, if someone has arthritis, we don't have to just say, well, I understand you have knee pain, but we have nothing to do for it. They used to just give cortisol shots for it, which helped decrease swelling and pain and inflammation, but it also did nothing to regenerate the joint. So there's treatments we have for that sort of thing. So that's the functional medicine aspect and the regenerative medicine aspect. So we're taking each individual, and a lot of these things aren't complicated. We don't need to take a complicated drug every day. They are basic things. Our body actually does millions of things all at one time in tiny microscopic detail, and just little particles are doing all these things. It confuses it if we add foreign substances to it, because the cells don't actually know how to react to it. Or some of the particles we're adding that aren't natural obviously can make all the cells sick. So we try to maintain natural things and do the things that the body actually needs itself and not a foreign substance. So these are things that I think everyone just needs to be made aware of, because we hadn't really concentrated on any of this. We just figured we'd be good until whenever, and then, if I have a heart attack, then I'll start something. But I think we need to really start focusing on preventative medicine to decrease the incidence, so that you don't need a Lipitor later, or you don't need to have cardiac cath or an angioplasty or something like that. So, because Again, a lot of these things lead to disability, and that's the main thing we're trying to avoid. So actually, that's just that's just a long explanation of the functional regenerative medication or medicine. But and these things that we're talking about with the functional medicine and the regenerative have been proven in studies. It's just that no one has really concentrated on except for the past 1 or 2 decades. So it's more recent information. And with the advent of realizing that the diets in the American population aren't the healthiest, either because of toxins, additives, pollutants, and things like that, there's a press to make sure we get healthy foods and not ones that are contaminated with dyes or preservatives and things like that. So that's the shift from the mainstream medicine to what we would like to address today, to go from waiting till we're sick and then addressing it to evaluating these things earlier in life and determining what may need to be done. Sometimes people develop symptoms first, and then that's when we look at it, and sometimes people just want to preempt it, and they come in when they're 30 or 40 and say, what can I do about this? I don't want to have dysfunction later in life. So we look at everything just to make sure you're on the right track. Let's see. So the regenerative process is really, yes?
I do have a question.
Mm-hmm.
Now, let's say a 30-year-old comes in and asks you for these tests.
Yes.
Does insurance cover it if they're not having symptoms?
No. So that's one of the issues we're also trying to address is insurance. If we're paying for health or healthcare insurance, they should be paying for our health care and not our disease treatment. So
Right.
we're trying to do that. But yes, right now they'll pay for the basic CBC, the CMP, and the thyroid, the TSH. It's very hard to even get them to pay for a vitamin B or vitamin D. So most times they do not. And I think that's why you see a lot of the labs. Some of the labs have come up with their own plans for that sort of thing. For example, some of them say, well, if you some of it's expensive. If you pay $4.99, we'll do all these tests for you. This many panels per year, and these tests will be included. We actually have an arrangement with Quest Labs to get a lot of these tests done at a really more reasonable rate. But your insurance won't pay for it, so that's why we've done that. That's why we have the different labs.
So then, can you give us an idea, like if we were to come to you and our insurance, knowing our insurance won't pay for it, and you decide we should probably have these things done, can you give us an idea of what it would run?
The initial panel for just like the basics with all those hormones and the vitamins and blood counts and that sort of thing is $100.
Oh, that's not bad.
Yeah, that's with Quest. Yeah, so they're very good about that. Some of the other ones like the homocysteine and the other the extended lipid panel, those are they're a lot more expensive. And there's also DNA genetic markers that we can check for breast cancer genes and cardiovascular disease and things like that. Of course, those are way more expensive. But the basic ones we look at are $100 for the first panel. So yes, the regenerative medicine, we're trying to, sometimes people again have symptoms, and that's usually what leads us for the regeneration. They have pain, they have symptoms that they're coming in for, and we look at that sort of thing. There are different mechanisms we can use to have tissue regeneration or tissue healing, not just getting rid of inflammation and swelling, which is what I think a lot of our modalities have been directed at prior to this. Yes.
I don't know if a lot of people know this. For pain or wound healing, that's not occurring very fast. There is a new regenerative instrument called Soft Wave that you can get that'll help, relieve the pain.
Is that a light treatment or what is that?
I don't know. It's not exactly a laser, but it's they even have an example of helping Alzheimer's. Someone that couldn't even draw a clock, and they saw improvement in that in the speech. But most of the time it's for wound and like if you have a pain in your back or hip or knee or something like that. And there's a local guy that's a chiropractor that does it on Fifth Avenue.
Yeah, normally those are light treatments. They have infrared light treatments and yellow wave.
It's more than that.
It's more than that? Okay.
Yeah.
So I'm not sure what soft wave incorporates then, so.
It's a sound wave.
Sound wave?
Okay.
Okay, okay. Oh, I guess the vibration energy helps with that sort of thing too. All right. Just the first one we'd like to talk about is the osteoarthritis. Like I said, that seems to be very prevalent, and we haven't really come up with any better ideas other than taking an NSAID, which obviously has its precautions because it can decrease the protective layer of your stomach, which can lead to ulcers and things like that. And it can lead to increased bleeding. So we don't like everyone to take an NSAID every day. Hopefully anyone would only have to take that episodically. That can also long-term affect kidney disease and cause damage with that. So we would like to, again, come up with different strategies. It's very prevalent. About half the population has some form of it, and it does cost the health insurance industry a lot, and the patients a lot of money to try and combat this. But a lot of the treatments right now are geared toward a surgery. So at this point, that's what is the mainstay, and that is actually what costs a lot. And then there's also disability, which will also cost a lot out of the healthcare dollar. So one of the first things, and you'll find the diet is very important to prevent all of these things. So the main thing, say three of the main things that we're trying to address with a lot of the functional medicine. One is an anti-inflammatory or antioxidant rich diet. And I did put some of that down there for you. And that, and what I mean, does anybody know what I mean by antioxidant, or anybody know what that means? So during like I said, in your body, all these processes and chemical things are going on, millions of them. So when these things happen, sometimes they produce particles that can cause damage to other cells. So our diet can either increase inflammation and cause more damage, or it can help us in getting rid of that damage. And the type of particle that can get rid of it is called an antioxidant. It just works by, a chemical reaction with electrons and things like that, but it can help. So that's why we would love to have the diet rich in antioxidants. And of course, we all know the high processed foods aren't any good, and high fructose corn syrup is actually labeled an addictive substance. Your body doesn't need it, it doesn't produce it, and it is addictive. So we would prefer no one ever eat that again, but obviously it's in the foods because it's very cheap for the companies to produce and use. And of course, on the socioeconomic scale, a lot of the lower economic people have to purchase those types of foods rather than healthy fruits and vegetables because they are because of the cost. Some of those things are just more costly, but hopefully things will change a little bit here with that. Fresh fruits and vegetables. Blueberries are excellent for an anti-inflammatory. Any other kind of berries, leafy green vegetables, tomatoes and peppers and those sorts of things really help. And if you're going to eat grains, they should have lots of fiber and omega-3 fatty acids. So some of the examples of that are brown rice, oats, and quinoa. Am I saying that right? Anybody know how to say that word?
Quinoa.
Quinoa.
Yes.
Okay.
We know what you'd say.
Yeah, okay. And of course, we like lots of omega-3 fatty acids. The most common place this is found is in fish. Salmon and tuna are examples of that. But the problem is not everyone eats a lot of tuna and fish every day, tuna and salmon. So it's really essential that we may want to have a supplement for the omega-3 because that is important for our cell structure and for producing hormones. we all know how important hormones are for regulating body mechanics or mechanisms and things like that. So nuts are great for anti-inflammatory response. Almonds, walnuts, pistachios, pecans, peanuts. Almonds also have vitamin E and magnesium in them, so that's another source in case anybody needs any more magnesium. And pistachios have some potassium in it, and I think everybody might know about bananas, but pistachios have that too. And of course, we know now that olive oil is very good for us. That's an anti-inflammatory one. And eggs. I guess eggs got a bad rap for quite a while, but now they're much better. Or we know that they're much better. They're full of vitamins, they're full of protein. They do have some cholesterol, but that's okay. It's the good cholesterol, and all the other benefits of it are way more important. So, and then some of the spices or things like that, that we can use is turmeric, garlic, and ginger. Those are also So that's an anti-inflammatory diet, and you're going to find that that's kind of pervasive throughout the thing, but it does really help with osteoarthritis. Some of the supplements we can also take are the omega-3s, as we said, and the glucosamine chondroitin sulfate. That supplement has shown to improve some of the joint health, so that's a good one. And of course, vitamin D. And vitamin D3 is the best absorbed, so we'd like to have that one. And there's other things like turmeric, or now they say ashwagandha, maybe can reduce some of the inflammation. And they also say hydrolyzed collagen can improve the joint health. And of course, we know weight management is great for arthritis. If somebody has an extra 20 pounds on their knees, that's going to cause a lot more stress, and that causes more inflammation. Then there's more pain and joint degradation, and that'll lead to dysfunction. So we would prefer that everybody try to maintain a healthy weight. We're not saying everyone has to have a BMI or be of 25 or be very skinny, but just a healthy weight would be great. Does everybody know what a BMI is?
A body mass.
Yeah, body mass index is kind of like how much your density is to how tall you are and things like that. But so the other thing that can help osteoarthritis, because it helps reduce a lot of inflammation, is hormone replacement. Testosterone is a very potent anti-inflammatory. So if we check your levels and see that it's not really optimal, that is a good thing to try to optimize. It does help most chronic forms of joint pain and muscle pain. So I think even rheumatoid arthritis, if I'm not mistaken. So it does help with that. And I do have a lot of patients saying they have vague pains or specific joint pains, and once they're on the supplements, they do say a lot of the pain is resolved. So it does help a lot with that. They've also shown that having testosterone replacement, and some of the women take estradiol with it too, but that has reduced the joint revision. So if you have a joint replaced, if you take the hormone optimization, then you will have a 40% reduction in having to have it revised. So there's a lot of studies showing it's very beneficial. Another thing for the arthritis, specifically for the joints, is PRP treatments. And PRP means platelet-rich plasma. And that is a procedure where we actually we take 20 cc's or 20 milliliters of your own blood, and we spin it down in a centrifuge, do some other things to it, and we get the plasma on the top once it's spun. And in that plasma, there's a lot of the platelets and a lot of the healing cells, and at the very bottom, there's a lot of the white blood cells. So that top part is very beneficial. It'll help tissue regenerate. So we do this process, we draw off the plasma, and then we do intra-articular injections into specific joints. So somebody said, yes?
Who does it here locally?
I do it, I don't know about anyone else.
Okay.
and you're connected with?
Oh, I'm sorry. Right now, I was with WellSpan and Summit for a very long time, but I opened my own office in Lanesboro, and it's called Impressive Aesthetics and Wellness. And it's in the Welty Medical Center, a couple blocks down from the hospital. I'm just, from my previous practice, I'm doing a little shift into trying to, again, I really want the disability to be reduced, so we're doing some, a lot of this stuff isn't mainstream medical, but it is proven to work, so that's why I opened that office, to try to address these things. Yeah, so we inject that, yes ma'am.
Now that treatment,
Mhm.
is it as effective in older people?
The more tissue you have to regenerate, the better it works, or the more effective. For example, if someone's come into me and said, you know, my doctor says I am bone on bone and I'm next to have surgery is the next option, I doubt it's going to be nearly as effective as someone who's had, you know, the knee issues for, you know, 5 or 10 years. If it's severe and it's bone on bone, it may not be nearly as effective. So it depends on how long they've had the process.
So not necessarily their age.
Right. It's not the age. If it just started and someone is 75, then yes, it's going to work. Yes.
Is there a practical way to determine where you're at on that? Where is it pain, or do you take an x-ray, see what's left there before you get the bone on bone and have pain?
Yes. I mean, usually, well, if it's bone on bone pain, they've already been to see an orthopedic physician. They've done tons of x-rays. If they're coming to me early on, several years, or we can do an x-ray, it depends on whether or not we're sure about the diagnosis. For example, if they've had a fall or something, we would definitely check an x-ray. If someone says, you know, I've been having this problem for, you know, years, but it comes and goes, and I take some anti-inflammatory and it goes away, and there's no major swelling and redness and things like that, we can tell it's not an infection type of thing. We usually offer an x-ray. Some people do it and some people don't. So that would tell us. It's a clinical picture that you can judge this from, or if you want to add an x-ray, that's perfectly fine too.
But if you're old and have no pain, don't worry about it?
I would do
That's
the,
my point. When do you get to where you could do something about it, but you didn't know you had a problem?
if you notice symptoms, then I would do the PRP. Prior to that, I would do make sure the weight's stable and the vitamins and healthy diet and anti-inflammatories diet. And they can inject joint stem cell lines also into the joint spaces. That gets a little technical, and stem cells are hard to obtain and things like that. But the PRP has been shown to be effective for that. Whoops. Fast forward. One more thing. Exercise. And you'll find that exercise is very beneficial for everything also. For the arthritis, it is very good to strengthen the muscles above and below your joints, so they are doing a lot of the work rather than having your joint ligaments and the tendons attached to it doing most of the work, because they're more fibrous tissues, but the muscles can take a heavy load, so it's a good idea to try and do strengthening exercises too. One of the things that we've shown actually is that thigh muscle strength is actually very important for predicting longevity. So strong thighs, strong hamstrings, and strong core, very important for producing healthy lifestyle or vitality in later life. So those really help. Okay. Let's see. Okay. So I know it depends, some people don't go to the gym, but exercises can be pretty easy. And they've shown that somebody who does chair squats, if anybody knows what those are, you just have a chair in front and you do this for 10 seconds release and come back up, go down for 10 seconds again if you can, and come back up. Doing that once an hour is just as effective as taking a 30-minute walk around the building. So the strengthening of those muscles, just doing simple things like that. Or another one for your low back. They're kind of hard to do without lying down or taking a different position, but if you lie down flat on the floor, all you have to do is come back like this because it'll strengthen down here. There's a lot of exercises, but we want to make sure that we're strengthening this core in the bottom. And then for the abdomen also, you could do what I call modified sit-ups. You don't have to lay on the floor with your knees up and come way up. You just have to come up so that you tighten your belly here. So that really does a lot to strengthen the core. So that does help too. It helps low back, helps your hips, and that sort of thing. Water exercises also help because they produce resistance in the movements. So that's kind of like doing weights with aerobic exercise. So that helps too. And let's see. So osteoporosis, again, is another one we'd like to prevent because fractures lead to disability. 30 to 40% of people who have a hip fracture do not get back to their baseline activity after that. Some people end up wheelchair bound or homebound, and it's very difficult to come back to your previous lifestyle after a hip fracture. So one of the things for that obviously is the diet. Vitamin D3 again, that is very beneficial obviously because we need that for the building of the bones. And sunlight helps with the vitamin D. Milk products help with vitamin D. The thing is, we would like you to get around 1,200 milligrams a day. So if you can, between diet and supplement, try to get that 1,000 to 1,200. And the calcium is, and I always give them the same dose. That way you don't have to remember the difference. But there could be little changes or differences, but in the amount. But calcium is in green leafy vegetables, obviously, and other dairy products. Again, this is between diet and supplement that we would need to get this. If you picture, one serving of a milk product, like an ounce of cheese, 8-ounce glass of milk, a cup of yogurt, they approximately have 250 milligrams to 300 milligrams of calcium. So you would need, 4 or 5 servings of a milk product per day to get what we think you might need. But between that and a supplement, if that's the baseline that we can get for that, that would be great. And obviously, protein helps with building bone. Vitamin C and vitamin K2. Of course, vitamin C is in citrus fruits, and then K2 is in green leafy vegetables. And you also need magnesium for healthy bone metabolism. So that's really important. One of the things that also can prevent osteoporosis is the hormone supplementation or optimization also. Increase in testosterone and estradiol levels do reduce osteoporosis and help prevent the fractures. The other thing that helps that, again, is the exercise. The weight training or the strength training help build bone mass. So that's also very beneficial. One of the newer things too that we've discovered is gut health is very important. We used to just try not to irritate our stomach when we ate or develop ulcers or take too much NSAIDs. But now we know it is very important for your gut to have the correct microbiome, which is just the amount of bacteria and things that it needs to actually function correctly, absorb the nutrients that your body needs, and to process different chemical metabolism throughout when you get things in your gut, the membrane has to be in great shape for your body to be able to get the nutrients. So that's what we're looking for with the gut health, is why we call it that. It enhances the nutrient absorption and helps cut back on inflammation. The things that help the gut health are, I'm sure everyone's heard, high fiber diet, fruits and vegetables, lots of fluid. Decrease ultra processed foods, which, again, that's the high fructose corn syrup and all those sort of things. And decreasing stress, because stress is a bad thing for inflammation and our health. It can cause a lot of havoc in all the body systems. When you have a lot of cortisol, it just gets in the way of healthy metabolism and processing the nutrients we need. So if you can, in your own circumstances, decrease what stressors you can. And then meditation helps a lot with decreasing stress, which is just trying to be calm, quiet, and process or concentrate on one thing, and with some deep breathing. That really helps to decrease the cortisol levels. One of the other things is the deep breathing is a great exercise too. If you sit calmly and just try and take deep breaths so that your stomach comes out like this. You can't do very good standing up, but your stomach has to come out when you take a breath in, as opposed to breathing like this. Because that creates if you breathe shallow and through your chest, then that can cause more anxiety and things. But when you breathe deep so that your stomach goes out, and then relax after they say 7 or 8 seconds, that is very beneficial for reducing the anxiety and stress. And exercise helps that too. And the other things that we like to have for this is probiotics and prebiotics. And these are the bacteria that we believe are a part of the gut that are necessary for us to absorb nutrients well. And there are lots of them out there on the shelf, supplements. You can also find them in yogurt, things like that. A multi-strain probiotic is better if you're getting a supplement for it. Oops. There's also other things like growth factors. There's a lot of things out now, like, yes, sir.
In that slide had acid, alkaline balance. Coffee, tea,
Well, caffeine beverages are the issue with that. So the caffeine is what we're trying to avoid with that. But yes. So yeah, a lot of the newer, I guess, peptides and things like that and growth factors that we can use also can promote bone formation. I will tell you, your body does produce its own growth hormone. And obviously your body does all this stuff naturally, we just have to give it some help. So we're trying to enable it to be as productive as possible. One of the best things that you can do for growth hormone production from your naturally is to not eat a couple hours before you go to bed. If you eat before you go to bed, especially sugary foods, that can decrease your production of growth hormone. So that is one of the best things you can do to get that naturally. All right, and so with the urinary incontinence, I brought this up because it's very important. And I know a lot of people think of it, it's just a little leakage, it's just when I'm laughing, it's just when I'm jumping on a trampoline or out with the kids, but this gets complicated because it can get worse, and it does affect people's lives. Sometimes, people have to take a Lasix and can't go out, or, they don't want to risk taking their Lasix, and so they stay at home. So it does affect function, and it can get worse over time. One of the main things that we do to try and avoid this is actually hormone replacement therapy, because it helps with the health of the pelvic floor. The weaker, it prevents the weak muscles in the pelvic floor and helps the health around the urethra. So sometimes we use the estrogen or estradiol locally, or you can also have the hormone replacement optimization for that. But the reason we don't want the urinary incontinence either to get better, or worse, I'm sorry, is because it can lead to urinary tract infections. And then we would like to address it. And some people say it's just a little bit. We don't really need to do anything about it. But when people do end up at home, then they get frequent urinary tract infections. Then, they got to worry about pads and being changed and things like that if they're bedridden. And you can develop sepsis easily. And we do not want any of those horrible complications to occur from this. So if it's minor, I can see a lot of people ignoring it, but I would at least just make sure it's addressed so that it's not progressive to get worse. Yes.
Do you recommend a bladder sling?
Well, but you can do a bladder sling. There's Botox. There's other things. There's surgery. Just for regenerative medicine purposes, the only thing is the hormone replacement. I mean, you can do surgeries and other things. There's also a vaginal rejuvenation treatment, which improves the pelvic floor muscle weakness, or it makes it less weak, and it also improves the vaginal lining and the external genitalia, so that the muscle develops and the tissue regenerates. So that actually does prevent a lot of the urinary incontinence and other issues alongside that too. So there is a treatment that can do that. Yes.
One of Deb and our yoga instructors, he would have us lay on the mat, put our feet together, and then lift up your pelvic, and then put it down and lift up. And then after you did it, he wanted you to put your feet closer, as close as you can to your body, and do the same thing. And we would laugh at it like, oh no, we have to do that again. But obviously it's probably very important to do that.
It is very important. I've had not mixed results. I think with the Kegel exercises and those pelvic floor at home muscle exercises, I haven't seen that they're as beneficial as some of the other treatments for it. I don't know if people, it's hard to keep up with the exercises and things like that, but I don't myself hear that it's been as beneficial as some of the other treatments.
But it wouldn't hurt if you don't have a problem.
Yep.
Okay.
Yep.
So that's good. So
it's fine.
Okay.
Yep. Oh no, it's good.
Okay. Thanks.
What are these neurological disorders that they're talking about related to that?
Well, you can have Parkinson's and things like that that will affect the nervous innervation of the bladder. And then there's Alzheimer's disease, which we can prevent some of too, because diet does have a lot to do with that. We would like, again, the anti-inflammatory diet helps a lot to reduce the damage that's been done from the free radicals in the brain. Good sleep helps reduce Alzheimer's disease process too. So getting up at, sleeping every couple hours and getting up at night is not a good idea. Again, that will increase the cortisol. And we think, I guess people think maybe sleep's not that important, but it is. Your body regenerates and recuperates and repairs everything. So good sleep is very important for health overall, but for the Alzheimer's especially. One of the things you can do for good sleep, and some people do have a lot of trouble with it, is to get up first thing in the morning and make sure you go outside and, you know, sit in sunlight for 15 or 20 minutes, or sit by the window and look at the sunlight for 15, 20 minutes. It kind of sets your biological clock to know that it's awake time, and then toward the evening when it notices dusk, it produces the melatonin to keep you asleep. And of course, you know, no caffeine later on in the evening and that sort of thing. Mental exercises like word puzzles, you know, math problems and things like that help. Exercises that, I say opposite exercises, which means that you're using one side of the body versus the other. So if you do a high marching like this down the road, that is actually helping your brain. So that is very good, and walking backwards is also very good to prevent Alzheimer's. It's trying to change, and your brain's trying to create new pathways when you're doing things like that. It's not doing the same old thing every time. So your brain is saying, oh, I better be more active and address this thing. So it makes it, you know, healthier, and it makes new pathways for neuron fibers. The other thing, balance exercises help with this. So like yoga, water aerobics, and things like that help too. So the other thing you can do is, like I said, change things up. If you brush your teeth with your right hand, try brushing it with your left hand. Instead of, you know, walking around the block going one way, do the other way, or take different routes, or you know, just various things. Change your routine up, because that keeps the brain active and more aware. The other problem is some medicines can contribute to Alzheimer's, and a big one is Benadryl. I don't know if, yes, sir.
Yes, somebody said to get rid of the beta-amyloid plaque,
Yes.
there's the quercetin, and then onion is helpful.
I'm sorry, what's that?
Is an onion quercetin?
Quercetin.
Is it very helpful?
Quercetin?
Quercetin.
Quercetin.
I'm not familiar with that.
So in terms of the onion,
It's an ingredient, onion, quercetin.
Oh, okay, I'm not sure about that one, sir. Sorry.
It's Querecittin, quercetin.
Okay, I'm sorry, not familiar. I can find out for you though. And we do think that Alzheimer's also can be related to the metabolic processes too. So lowering sugar in your diet really is beneficial for that too.
Did you mention Benadryl?
Oh, I'm sorry.
Yeah.
So Benadryl, yes. Your brain learns from having certain chemicals in it. One of them is acetylcholine, the other one is dopamine, and one of them is norepinephrine. But Benadryl can stop the acetylcholine. It blocks acetylcholine from being produced. So it's not very good for us if we want to retain memory. I know a lot of people take it for sleep, but when you're sleeping again, that's a process where your brain is trying to heal and incorporate memories into your brain. But if you take the Benadryl at night, it's blocking the memory, I guess I call it the memory makers, which help with that. So that can lead to some Alzheimer's symptoms. So can Lipitor, because it decreases the cholesterol that makes hormones and cell membrane walls and things like that. So we just have to be careful when you're using medications, and just try to weigh the benefits versus the risks. Yes, ma'am.
What can you do if you've tried to get off a Lipitor and it just keeps, if you have a history of hypercholesterolemia, and there's nothing, diet, exercise, nothing. So what I'm doing, I just take a low dose of Lipitor and I use bergamot. It's supposed to decrease your cholesterol, but I just haven't been able to get off of that Lipitor. I've tried everything, diet, exercise, just everything.
Do you have heart disease?
No. Well, I do have a family history. My father dropped over dead at 46 with a heart attack. My brother's had 3 open heart surgeries. So it's in the family, it's very prevalent.
Okay. It also has to do with the panel, the numbers in your panel. For example, some people have high cholesterol and their HDL is very high. That's not nearly as detrimental as not having a high HDL. If you have a high HDL, which usually would mean 60 or above, you're at very low risk for having any coronary artery disease, which means the
Can
plaques
you
in it.
repeat that? At 60 HD high?
68, if you're HDL, which is the good kind,
Yeah.
if you have 60, you're at much less risk for developing clogged coronary arteries.
60 or
Yeah,
above.
so that panel, some people when they say high cholesterol, well, it might be total, but your HDL is 90, so that's great, actually. So it's hard to tell. But omega-3s, taking omega-3 fatty acids also, are you doing that?
Yeah,
Okay,
I
the
take
CoQ10?
I do it once a day.
Okay,
The,
all right.
Nordic Naturals, I take that.
Okay,
I would really like to stop taking that lift. I only take 10 milligrams. But it seems like as soon as I stop it, it's just, whoa, my levels are just way off the chart.
you may want to get those other tests, the extended cholesterol panel, to see if the ones that really are associated with the cardiovascular disease are part of your issue. And check the inflammatory marker, the homocysteine one.
Almost just,
Homocysteine, yeah. Those are on the list of the labs.
it's very frustrating because at least I'm only taking a very low dose. I take a CoQ10 with it. So,
Yes, so,
but I have a history of Alzheimer's in my family, big time.
Okay.
So that's another thing.
have you ever had any heart testing? No.
If there's a calcium testing you can get done, is
There is, yes, you can.
do you order that too?
I don't order the calcium testing for the cardiovascular disease right now, but we usually do all those other things, the other lab tests first before we do anything that invasive, or, because it's a lot of radiation with the dye and things like that.
Oh, okay.
So, but those are things I would check, your homocysteine and the extended cholesterol panel, to see if you're at higher risk.
I have to make an appointment.
They do have, there's also DNA testing that you can do to check for some of those things, so, but in any case, yeah, there's other things you can check, and the theory most recently has been, we don't wanna necessarily, and I know you have a family history and that sort of thing, we don't necessarily wanna use one of those statin medications unless, we know you have diabetes or heart disease, or we know there's plaque there, or, some things like that.
I get scolded by the doctor every time I try to go off of it. I get yelled at, like, show the family and the other one.
Do you see a cardiologist?
No.
Okay.
No.
So sometimes people or healthcare clinicians aren't aware that there's other markers they could use to see if it's absolutely necessary. So the other thing, one of the last things is the sexual function and decreased libido. And I wanted to bring that up because that actually declines, I would say, 75%, especially in females. And it does cause a lot of things like marital discord, just because of discomfort that can occur because of low estradiol levels and things like that. The things that usually improve that, obviously, are the diet and the exercise and the hormone replacement. I just wanted to mention that because sometimes those things, they're pervasive, and it's a great idea to try and have that addressed if it becomes especially an issue with marriage, and those hormone replacements can really help. But I see a lot of people really benefiting and actually preventing divorces. So just a lot of people, it benefits. So, all right. And then also for the sexual health, if libido is an issue, we do have PRP treatments which can generate new tissue and regeneration for stimulation and things like that in the genital area, and we also have a vaginal rejuvenation that can be done to improve that sort of thing too. And I think we went over the gut. And of course, again, this is all, what symptoms you're having, and then evaluate what's going on, check your labs, come up with a treatment plan, and then the important thing is to try and follow it, because I think previously everyone was just thinking everything was great and I'll take a medicine at the end, but we want to prevent all those issues at this point. So. Anybody have any other questions?
I have a question, though.
Yes.
I don't know if you can answer it or not. I don't mean to put you down. It's like you go to listening to this lady, similar situation. You go to the doctor and he shows you this chart of, based on the cholesterol, just the main thing, that you're in the 20% chance risk of getting, having a heart event. And so you need to take the statin, but I've taken the statin and it causes very negative impact. I would not take it again. So that's just where that person is. That's what his thinking is. So your approach sounds more the paradigm shift. How do you, what is your recommendation for integrating to a more rational approach if your goal is to live, as healthy as possible, not to be taking a drug that's making me feel worse, so I'm not doing my exercises and all that. What are your recommendations?
I think if there's a question, we probably would do more testing just to either the lab panels or, we can do an echocardiogram or something. We can tell if there's any active coronary artery disease, and if there is, then it might be more beneficial to try and, make sure you're on a Lipitor or if somebody has diabetes, it's more important because that's a risk factor for cardiovascular disease. But I would do more tests to see exactly what your risk is, rather than just going by one number like that.
Okay.
I need to, Orville, do you have the basket from the dose entry form? Can we collect those? If you haven't filled out your dose entry form, that would be great.